A 22 months old child is brought to the clinic by her mother, who is concerned that she has developed swelling in her neck. On examination, she has a soft lesion located in the posterior triangle of the neck, which is transilluminate. What is the most likely diagnosis? This one point is enough to diagnose this portion. That means the transilluminate, the swelling which is transilluminate and present in the neck area. Here the options are lymphoma, cystic hygroma, rhabdomyosarcoma, branchial cyst, and dermoid cyst. So which of the following option may be the answer? First of all, let's see. This is a huge swelling present in the posterior triangle of the neck, and in this baby it is present this like this, and it is brightly transilluminate. So what is the disease? This is the another picture showing this is the huge swelling present in the posterior triangle of the neck. Here we can see this is the another swelling, and it is obvious that it is very shiny. That means the transillumination test will be positive in these two cases. And here we can see the branchial cyst. It present also in the lateral part, but usually it is not the transillumination positive. Now see details about the thyroglossal cyst. The thyroglossal cyst, it is located anterior triangle and also in the posterior. The thyroglossal cyst, it usually present in the anterior triangle of the neck, and the thyroglossal cyst usually in the midline below the hyoid bone, and it is the remnant of the thyroglossal duct. And the most important diagnostic point that it is moves upward when protrude the tongue. And the branchial cyst, we know there are 6 branchial arches separated in the branchial cleft, and when there is incomplete obliteration of the branchial arch, in this condition branchial cyst develop, and 75% of the cyst originate from the second branchial cleft. So what is our answer? Our answer is this cystic hygroma. Because why it is cystic hygroma? Because cystic hygroma usually located in the posterior triangle, and it is the transilluminate. It is brightly transilluminate. Other options here such as the lymphoma, rhabdomyosarcoma, branchial cyst, dermoid, they are not brightly transilluminate.